Saturday morning. I'm going to go ahead and start sharing my screen so we can get started with the PowerPoint presentation. All right. So we'll go ahead and get started. All right. So like Natalie said, myself and Delia, we are with the Area Agency on Aging of the Capital Area. We are affiliated with the Capital Area Council of Governments. We service a 10-county region. We are a regional partner directed by local governments. We assist with regional planning in a variety of areas. And so part of our mission as the Capital Area Council of Governments is to coordinate and facilitate collaboration among local, state, and federal officials on the same topics and seek out opportunities for regional cooperation. The mission of the Area Agency on Aging is to provide quality services to support and advocate for the health, safety, and well-being of the older individual in the region. Now, you also have a mission as well. Your mission is to spread the word about our agency. Now, the Area Agency on Aging is funded through the Older Americans Act. So we are, through the Older Americans Act, we have been entrusted to provide quality services to support and advocate, again, for the health, safety, and well-being of the older individual in the region. Just like I mentioned, in our area, we service all 10 counties that fit in our region. Now, Area Agencies on Aging actually serve all areas of the U.S. So we do have some different names across the U.S., but the Area Agencies on Aging, they do exist on the federal level. Now, the core programs that the Area Agency on Aging provide include information, referral, and assistance. We also provide nutrition services. So we provide home delivered meals. Prior to the pandemic, we were providing meals at congregate sites. So a site where, such as a senior center, where people can go to one site and to have a meal during lunchtime and also participate in any social activities that are being held there, and also at senior center operations. We also provide benefits counseling, which is help with Medicare and other public benefits. And just to let you know, the rest of this presentation this morning is going to focus mostly on that benefits counseling portion. We also do provide care coordination, caregiver support, and respite support. We also provide medication screening, as well as ombudsman services, which are advocacy services for people living in assisted living facilities in our region. And then we also provide health and wellness education courses. Now, what is benefits counseling? So benefits counseling consists of Medicare assistance, which means enrollment into Medicare for the first time, as well as assistance with any issues that you may have with Medicare, such as payments for services, an issue that you may have with a certain provider. We can help provide guidance and assistance on any issues related to Medicare. We also can help you compare Medicare Advantage or Part C plans and prescription drug Part D plans. And we're going to talk a little bit more about those Part C and Part D plans in a little bit. We can also help you with Social Security benefits information. One thing to keep in mind, if you have not decided to take your Social Security benefits, one thing that has happened this year is a lot of those services are now being offered online, which is a new feature that Social Security has rolled out And it's been very beneficial because you don't even have to create a My Social Security account to do it. So it's made it a lot easier for people to enroll in those benefits, you know, from the comfort of their home. We also collaborate with Texas Legal Services Center regarding minor legal issues, such as the transfer on death deeds, as well as helping to establish Ladybird trusts. We also focus on fraud prevention with the Senior Medicare Patrol out of the Better Business Bureau in Houston. We also help with advanced directives, as well as screen and help people apply for the Medicare Extra Help programs, such as the Low Income Subsidy for prescriptions or the Medicare Savings Program for the Medicare Part B premium. Now, let's see if I can get this to work. Just had a little video that I wanted to share with you about the State Health Insurance Assistance Program, or the SHIP program for short.
Hey, Alice. There's no audio.
Oh no.
I thought I heard a little bit at the very beginning, but then it stopped.
Oh. I put the caption on. I put this. Make sure.
We will also share this video clip with you all.
Perfect.
In an email after this presentation. Sorry about that.
No worries.
State health insurance.
So that being said, so one thing I do want to point out is that in Texas, our SHIP program is also referred to as the HICAP program by the state of Texas. It's the same program. So basically, if you are receiving any information from Medicare, a lot of times they mention contact your local SHIP program. That's us. That is the benefits counseling program from the Area Agency on Aging. I know also some people have called 1-800-Medicare, and it'll actually direct them. They'll direct them over to our agency. So if you hear any information about the SHIP program, that is the benefits counseling program at the Area Agency on Aging. All right, so who is eligible for help from our agency? So anybody age 65 and older who is on Medicare, but also we wanted to point out, when we say anyone who is Medicare eligible, it really means anybody. So I know our agency primarily helps people age 60 and above. We can help people who are not 60 and above with their Medicare issues. So if you happen to know somebody who's on disability and they are having some issues with Medicare, you can send them over to us and we can help them. For example, we've actually helped young adults in their 20s with their Medicare issues. So if you know anybody in your family or in the community that, you know, is needing some help with Medicare, you can send them over to our way and we can help them. All right. Now, we also can help any family member or designated person helping the beneficiary with Medicare. So it can be, you know, a daughter, it can even be a social worker. As long as you have given them permission to advocate on your behalf, we can work with them and help them answer any questions that you have or any issues you have, help you with any issues you have with your Medicare. Okay? Now, what is Medicare? So Medicare is a federal health insurance program. It is managed by the Centers for Medicare and Medicaid Services. And Medicare, you must be age 65 and older, or be any age and deemed disabled by the Social Security Administration. You also must be a U.S. citizen or a legal permanent resident. So there is a residency requirement when it comes to Medicare. Also, if you've been diagnosed with end-stage renal disease or ALS, you also are eligible for the Medicare insurance program. Now, the Medicare program, the basics of Medicare, it's consisted of two main parts. It consists of Part A, which is hospital benefits. Now, hospital benefits include inpatient hospital, skilled nursing facility care, home health care, and hospice care. Part B is known as your medical benefits or doctor benefits. So that's going to cover your any outpatient services, any services from doctors or providers, as well as any preventive benefits and any durable medical equipment benefits. So when you are in Medicare, when you enroll in Medicare for the first time, you will have Part A and Part B, and those are the basics of Medicare. Now, it is important to note that Medicare was never intended to pay 100% of your health care costs. Also, Medicare does not cover any non-medically necessary services. And that's important to remember because a lot of times people run into the issue of not having a procedure covered or not being able to get a piece of equipment because they are missing the most critical piece, which is that procedure or durable medical equipment medically necessary, meaning a doctor has said that you need this item or this procedure. That is the key to getting your Medicare, any services under the Medicare program covered. Also, Medicare is only, you only have Medicare coverage in the US in most cases. Now, if you are traveling and you are near the US border, say you are in Canada, it is possible to still get get access to your Medicare insurance, but it's mostly on a case-by-case situation and depending on the severity of the situation. Now, so just remember, Medicare, the basics of Medicare are composed of Part A and Part B. Now, Medicare has also expanded into Part C as well as Part D. Now, Part C, or Medicare Advantage plans, those plans are managed by private insurance companies. So you may have seen some advertisements from Humana or United Healthcare regarding Medicare insurance. They have been contracted by the Centers of Medicare and Medicaid Services to provide your Medicare benefits. So think of them as like HMO and PPO plans. you are still going to be following that insurance plan's rules as far as where you can go to access care, but you still have Medicare insurance. It's just that they're being privately managed. Part D stands for drugs. It's the Medicare prescription drug coverage. Now, one thing to keep in mind, Part D is considered voluntary. You're not required to sign up for Part D. However, if you are taking prescriptions, it's highly advised that you sign up for Part D when you are first eligible for Medicare. And that being said, I'm now going to turn the screen over to Miss Delia. Delia, do you want to unmute?
Okay, can you hear me now?
Mm-hmm.
Okay, I was talking to myself. Okay, Medicare has two options, and it has Medicare Original, which is the A and B, and then the prescription, which is the Medicare Part D. And then you have the option of getting the secondary insurance, which could be your group insurance from your retirement, or if you're still working, or a Medigap, or if you have Medicaid, that will cover all your needs. Or you can go with something different, which is option 2, which is the Medicare Advantage plan. And I always see it as a bundle. It's something like a lot of the TV station, like Sprint or one of these companies, they have bundles, and this is a bundle. This is going to take care of all your medical needs, which is the hospital, the medical doctors, prescriptions, and they're the person that you're going to go to, because basically Medicare is going to step out and let the Advantage plan take care of you. Okay. Alice. Okay. Now, applying for Medicare for the first time, which when you're applying for Medicare for the first time, it's like learning a totally different language, things that we never thought of, or even, figured out that this is what we're going to have to learn for the future, and also help our parents or our caregivers, friends. And a lot of times you go to places and you hear people talking about, oh, I just enrolled in Medicare and I'm getting 100 calls and I don't know what to do. And they're all promising me all this. So this is all new and it's overwhelming. So the first thing is enrollment automatically into getting Social Security or retirement benefits prior to Medicare eligibility. All others must apply through Social Security or retirement during their 7 months initial enrollment, which means you have 3 months before your birthday, on your birthday, and 3 months after. So you can decide what you want to get. Now, if you have coverage under yourself or your spouse currently, whether it be a retirement group or whether it be that you're still working, you may delay enrollment into Medicare Part A and B. But always remember that Medicare Part A, there's no cost to it. And actually, it could help you in the long run if you ended up in the hospital and you had a group insurance, that Medicare Part B is going to pay for your hospital stay. Now, Part B, there is an amount that you would have to pay, so that's optional, that you can take it at a different date. Okay. Okay, so now all our lives have changed because of this coronavirus. So remember that public health emergencies, local Social Security offices are close to the public, but may service, there are services available online or over the phone. If you need help from Social Security, there's a website and there is a phone number to call. But remember that you might have to do a waiting game if you call the 1-800 number, because it might take maybe an hour to call back. Now, I believe that there is a function where you go ahead and put in your phone number, your name, and they can call you back. Or you can just go online and fill out your request and they will call you, but their hands are full and they do have a lot of people. And like all of us, we're all learning a different way of living and working because of this coronavirus. Okay. Now, if you cannot enroll on Medicare online, where is what you should do? This is what you should do. Okay, you gotta contact your Social Security office. And again, we know that they're closed and they should still be able to mail you your information and process your enrollment work. Call your local office and learn more about how to submit your enrollment. A lot of times the smaller Social Security offices do have local numbers and you can get a hold of somebody basis a bigger Social Security office like the Austin office. If you go here to Georgetown, they have a tendency to answer your questions faster. So gather necessary information to enroll in Medicare Part B. You should first complete the CMS 40B application for Medicare enrollment. It is available and there's a website or through the SHIP program. We can also get it for you and mail it to you with no problem. Okay. If you currently lost your job, and a lot of people that had been working and because of this corona have lost their jobs and have lost their insurance. So you would have to submit the CMS L564, and it's also available on the cms.gov worksite. And an employer usually fills out the Section B of the form, but at this time, you're not allowed to fill out the Part B. So always remember that you have to have a trail and you have to have something in writing that you lost your job so you don't get penalized for the Part B. And proof of your employment or health coverage. For example, your W-2 form that shows you had insurance premiums paid. Your W-2 reflects your pre-tax medical contribution. Your pay stub that shows that you had health and where it was deducted. Your health insurance card that shows the date the policy began. And explanation of benefits paid by the employer-based insurance, statement of receipt that you show payment of health insurance premium. So all this is really important, and it's always good to keep it, because when you're applying for Medicare Part D, which is your prescription, if you don't get it at the beginning, you will have penalties that you will have to pay monthly for every month that you did not enroll and did not have credible health, prescription program. So they might come back in 2 years and say, you didn't have insurance for your medication. So now we're going to penalize you this amount, plus you're going to have to pay your Medicare Part D. So that will add up, but you can always go and say, no, look, I have proof and this is my proof. And they will take you on it because it does happen. Okay. Okay, send your paperwork to your local office by certified. When using certified mail, you will get a receipt to confirm that your mail was delivered, which can be helpful in the case that there are any problems with your enrollment. If you cannot get the post office, you can also see priority mail from your home, which provides tracking information but no confirmation. And again, very important, take pictures, keep copies. You know, when you send the certified, take a picture with your phone, keep it, just in case some reason they lose it, you're gonna have proof of this. And the majority of our phones do have the capability of taking pictures, so it doesn't hurt to have one more picture. If you experience issues from your local Social Security office, such as being told that your enrollment cannot be processed, contact your federal elected official. Elected officials may be able to help you with your problem, especially right now that there's election season. Everybody wants to help everybody, so remember that. Okay, this is the big one that we're really getting into, and we're excited, but we're also getting a little nervous because this is all going to be different for us, and that is the open enrollment. Open enrollment starts October 15th through December 7th. The one time of the year when all individuals in Medicare can change to their health or prescription drug plan for the next year. So if you do this in October, it's not going to happen until January. So remember that you can change, you can review it or change Medicare Part C and D plans or switch back to Medicare. If you decide you didn't like them, you just want to get original Medicare and be responsible for the 20%, this is the time to do it. And this happens the same dates each year. And the new coverage again starts January 1st. Person affected by Medicare open enrollment receiving, so if you're receiving Medicare and Medicaid benefits, you don't have to worry about it. If you have TRICARE for Life, which is the military retirement spouse or military medical retirement and spouse, are over 65 and still working and have credible insurance and prescription plan from your employer, or if you have retired credible health insurance prescription coverage from an employer. So if you have your retirement and it has insurance and they're offering the insurance to you and you take it, that's going to pay for your health and prescriptions. And also remember that you will get salespeople coming up and telling you that, yes, this is a great retirement plan from, maybe you work for the government and you have a very good insurance, but you are paying like $200, $300 a month. And these Advantage plans will tell you, well, you know what, if you enroll, it's zero plan. And you know, that big zero, you're saving this money a lot. And they also add this part, and you can always go back. No, you can never go back to any of these plans. So when you decide to take an Advantage plan, make sure that you really thought about it and it's going to be something that you're going to want, because you can never go back. Okay. Okay. Now, how to get help with open enrollment during this COVID procedure. Visit agency's website to fill out application packet to request a comparison assistance. Don't forget to include your Medicare information as well as the list of medications. Contact the AAA by phone or request assistance. We have ourselves that will be taking the contact information, completing the phone, the paperwork on the phone. And of course, all of us are certified benefit counselors, and we will complete the comparison, and then we will contact you to discuss it. Now, this might be a little bit different because the volume, so sometimes the benefit counselors will also be taking the information and doing it right there and then to help you with your enrollment. What we usually do is we give you an option. We usually compare 3 plans and tell you, okay, these are the plans that seem like meet your needs, and these are the amounts. We can always go in and make copies for you, send them to you. But like we've discussed on the Medicare Plan Finder, it's just copies and copies, and sometimes it's overwhelming. The earlier the better that you call us so we can set appointments up, and most all of our appointments will be through the phone or through Zoom. And there will be a cutoff date for open enrollment, helping in late November, early December. So the earlier that you get with us, the more time we'll have to help you, more time you'll have to decide, and you can review them. You don't have to actually enroll that same day that we talk. You can look at it, sleep on it, look at it the following day, go with it, show it to your caregivers, and let them review it, let them go in there and see, and make sure that you get the best plan that you need. Okay, Alice. Okay, so now Medicare Improvement to Patients Providers Act, the MIPPA program. Information access to Medicare Extra Help, which is helping pay your low-income subsidy, Medicare prevent health benefits, and extra help for persons on Medicare not receiving Medicaid and limited income resources make it difficult to pay Medicare Part D prescription drugs and all Medicare Part B premiums. The following programs may be available, which is the low income subsidy, which we call LIS, and it helps pay for your medication. It gives you an amount monthly to pay your premium, and most of the times your medication will be less than you would have to pay. And Medicare Savings Program, which is the QNB medical benefits to help pay your Medicare premium, co-pays, and deductibles. So this will help pay for your Medicare Part B, as well as when you go to the doctor, it helps pay your 20%, or if you're in the hospital, it helps pay that 20%. Now, the last 2 programs is the SLIM and the QI1 for help paying the cost of your Medicare Part B only. Those 2 programs are going to pay the $144. The only difference between the SLIM and the QI1 is the QI1, if you decide you need a provider through the state, they're going to tell you, because that is federally funded, it's going to tell you, do you want us to pay the $144 or do you want to get the provider? That's the only difference. Now through SLIM, You can have both. But again, all this is income eligible. So it depends on your income. And information access to Medicare prevention. And this is when you start Medicare, and it's a welcome to Medicare. The first time you go see the doctor, it will help your annual visit. But always remember, when you going into for your annual visit, that you tell the doctor, tell the nurses, this is my annual visit. I'm not going in there because my diabetes is up and I don't feel good, or I'm having trouble seeing because of my lipoma or depression or something. I always say it's a prevention, because then they'll code it different, and then you might have some out-of-pocket costs, and you'll come out and call us and say, well, this was my welcome to Medicare. But that's not what the doctor heard, and that's how he coded it. So that's very important that you do that. It covers all these benefits. It also covers your flu shot or pneumonia shot, and that's something that we're really pushing to get done. So that right now is a time to go get your flu shot, pneumonia shot. There's no waiting, and it's a perfect time to go into your pharmacy or your provider to get this done. Okay. Now, for local help with Medicare, contact the State Health Insurance Assistance Program SHIP if you need help enrolling in Medicare. And guess what? That is us, the Area Agency of Aging of the Capital Area. And that's our phone number, and that's our email address, and that's our website. And to find the SHIP in another state, that is the phone number to call, the 877-839-2675, or visit www.shiptacenter.gov. So, okay. Alice. And so that is basically it. Thank you so much for your time. I know it's a Saturday morning and it's a beautiful morning to be outside, but we're so glad to be able to give you this information at this time. Thank you.
Thank you. I do have some questions.
Okay.
I will, and you and Alice can, just jump in whenever you're ready, or whoever wants to answer. Let's see. I have a question that says, I'm a long distance caregiver. Mother is in California. She's looking for an organization in that particular county that can help with these types of questions. I'm assuming that the number at the bottom that you just read is a perfect number to call to locate the specific office that can help.
Right.
Yes, that's correct. Yeah, in California, it's structured a little bit different out there, but yeah, they do have their, I want to say they also use the word HICAP to describe their state health insurance program. But yeah, I believe they have one in like each county.
Right.
So yeah. And I will absolutely provide the information that was provided to everyone. So you have the number to call here locally, the email, and the out-of-state number to contact. So the next question is, does Part C incorporate Parts B and D? So you can enroll in Part C without enrolling in Parts B and D. And it goes on to say, if you are enrolled in an employer group health plan, CSRS retiree, and decide to switch to Medicare Parts B, C, or D, after you're 65, do you get penalized for not enrolling in these Medicare parts during your initial enrollment period? I could reread this if you want.
I think I know what, I think I know what they're referring to. So, basically, I'll start with this. If they're still working and are in that group insurance plan, the most important thing they need to do is make sure the group insurance plan is considered creditable coverage to Medicare. So it's equal to or better than what they would get with Medicare. And it kind of sounds like this employer is probably bigger than 20. They probably employ more than 20 people. If that's the case, you know, they should be good to continue in that group plan until they are absolutely ready to retire. And then Delia, do you want to talk a little bit about the Advantage plan, what they consist of? And
Okay, and also remember that the Advantage plan covers the A, the B, and the C. But there are deductibles, and you do still have a choice if your retirement program allows you to keep your insurance. Weigh your options, and that's another thing that we're there for. We can go ahead and compare the plans and tell you, okay, this Advantage plan, you don't pay zero, but you're paying so much every time you go to the hospital, and this is how much max you're going to pay out per year. For example, if you were in the hospital 2 or 3 times, your max might be $7,000 because it'll show how much you would be paying. So basis through your employer, it might be less, or Advantage plan might be better for you. But that's how you have to compare. And we're there to help you do that as well.
one thing to also remember is, regardless of whether you decide to stay with the original Medicare program, which means the red, white, and blue card from that you'll get in the mail from Social Security, that's your insurance card, or you decide to do a Part C plan, which rolls all of your A and B benefits together, you have to pay for the Part B premium. Think of that as your membership fee to the Medicare program. Everyone has to pay it. The only time that you may not have to pay it is if you qualify for one of the Medicare savings programs, and that is going to be based on your income and resources. So regardless of what Medicare option you go with, everyone has to pay that $144 premium every month, and the majority of the time it's taken out of your Social Security check. But if you're not taking Social Security when you enroll in Medicare, then you will actually be paying that bill out of pocket, and you will be billed for it separately from CMS.
Thank you. That and I have a question here. So I think Delia, you mentioned that you can never go back if you switch to a Medicare Advantage plan.
Okay.
Can you expand on that?
Okay, if you have a group insurance, like if you have a federal insurance program, you retired from the state and they offer you this package deal, and you can continue paying that for you and your spouse. And then you go to a luncheon that they offer, and they offer these plans. They tell you, if you enroll in an Advantage plan, you're going to be saving $200 or $300 from your retirement. And so you're going to have money in the bank. So you're going to get more money. And this is going to give you the same thing your retirement gives you. So if you say okay and you enroll in this Advantage plan and you decide to drop your coverage from your retirement, you can never go back.
You can't go back to your retirement benefits that
Right.
were, okay.
Right.
Does that, and you, if you submitted that question, feel free to unmute yourself. If you feel like you have another question to ask, or if that was clear, feel free.
Would you still have the opportunity to swap between Advantage plans during the next open enrollment, or are you just like locked forever?
No.
Like, in my case, I'm still working. It's not, I'm not getting the retirement insurance, but I'm still working. My husband is on my insurance, but he's disabled and he's just turned 65. So I'm
Oh, okay.
am I better off keeping him on my insurance, moving to one of those? I kind of put it on the back burner, waiting until I was forced to do something because he turned 65, because he had a specialty medication. But he's been getting, you know, gobs of calls, and they're saying that they do carry this, that they now, this medication that he needs is on their approved list. And so now we're seriously considering it, but if we're locked in, that scares me.
Yeah, you can always go back. I mean, like next year, if you're not pleased with this Advantage plan, you can go to another one. But you have to weigh how much these Advantage plans are going to cost you yearly, and basis what you're paying through your group insurance. And basically, group insurances are going to they're going to be better than any of these Advantage plans. And that's
Okay.
being personal, you know.
Thanks.
Because your group insurance also has dental and vision. And these Advantage plans, it's part of their incentives. They say they have dental, but it's just a preventive. They have eyeglasses, but they're going to say, okay, this is just the little group of eyewear that you can get. So if you're going to want to get different things done through your dentist, it's going to end up being out of pocket. They might pay a certain percentage, but very, very little.
Gotcha. Thanks.
Plus, it's still deductible on your, for your, if you have the cafeteria plan, that you can go ahead and put it under your cafeteria plan where you don't pay taxes for your insurance. So that's another thing. So yeah, but I would also go ahead and make sure that you keep copies of, you know, a check stub or something in case something ever comes back further down the line as we get older. Did I answer your question? Okay.
Thank you. Let's see. So for assistance with comparing benefits and I guess the plans and who is that? Do they call you guys? The area agency on aging?
Yes.
To help with that? Okay, because that was the question. They just wanted some clarification on who to call for comparison of benefits.
And also remember, the sooner the better.
Okay. So let's see. Do you know what, this is the next question. Do you know what prompted the increase in hearing aid benefits from $600 per year to $1,200 per year in 2021? Do you guys have any insight on that?
Nope.
No, that's and here's the thing is that those are what's offered. Generally, that's offered through Advantage plans. So that's going to be that'll be a question that you would have to ask an insurance agent with that specific plan.
Okay. Says, can Medicare cover spouse or dependents?
No. It just covers you.
Only those who are that are eligible for Medicare. So like, yeah. So if you are, for example, if you have your family on an Obamacare plan and your name is on the policy, the minute that you are eligible for Medicare, your family's going to have to get a new policy because they can't be on Medicare with you.
Okay. So let's see. Can you expand on having Medicaid due to disability and then turning 65? What are the eligibility options and changes?
So the thing is that sometimes people who are on disability, depending on what type of if they are receiving an SSI check, and Delia, you might have to jump in onto this one. Sometimes people, if they qualify for disability, you know, because maybe they were given what's called an SSI check. So those checks tend to be on the, you know, on the lower end. You know, once you become eligible for Medicare, yeah, you will lose your Medicaid, because Medicaid has a certain benchmark as far as how much money you can get per month in your check. And this year, I mean, it's basically under $800. So sometimes some people, they get just enough or it pushes them over, you know, $800 a month. But when it comes to Medicare, I mean, they're still responsible for that $144, even though they're getting that, you know, small check. They still have to.
Yeah, as a rule, what they usually do is if your income is low, the state automatically, they put them under the state Medicaid. So between Medicare and the state, they'll be covered. And Medicaid used to be something that everybody wanted to get because it used to cover prescriptions. Now, Medicaid and QMB, which you can make a little bit more, is basically the same thing because now it covers all the medication. So people still have that vision that if you have Medicaid, you have everything. But if you have QMB and Medicare, you're pretty well covered as well.
Yeah, sometimes that rollover, it's not automatic. So you still have to, basically you could lose your Medicaid, but you still have to apply for the QMB. So it's one of those situations that the minute that you notice that you are going to lose your Medicaid, that would be the best time to contact a benefits counselor so we can kind of go over what's happening, you know, and then we can make a game plan to get you to apply for QMB so that you're not, you know, experiencing, you know, a loss of, you know, coverage to your medical providers or losing access to, you know, prescriptions. It does happen. We do get some of those situations. It's just the sooner you know it's going to happen, the better it is for you to reach out to us so we can create a game plan so we can minimize that disruption.
And most of the time, Social Security will give you heads up months and months before this happens.
Thank you. Here's another question. If someone is on COBRA and is over 65, can you switch anytime to Medicare, or do you have to wait until open enrollment?
You can change, but you're going to drop COBRA. Now, I know that some of the employers were offering to pay for the COBRA, and they would only pay whatever their monthly premiums were, and the company was going to pay for the rest for a certain amount of time. If that is the case, they can continue in COBRA and just pay the 100 and something, because COBRA is going to cover more than an Advantage plan. Now, once the Advantage plan, once COBRA ends, because it's only good for 12 months or whatever they decide on, it's usually 12 months, then you can go ahead and change, because COBRA is a very expensive product to get if you're doing it on your own. So if your employer, and this is what's happening to a lot of employees because they're losing their jobs because of so many places closing, that the employers are offering this as a packaged benefit.
One more thing I wanted to add about COBRA and Medicare. The thing is, the most important thing is you have to consider which insurance you have first. It's possible to get COBRA if you already have Medicare and you can keep, you can have both. But if you have COBRA first, it's a little bit, trickier when it comes to Medicare. So if you have COBRA, when you become eligible for Medicare, your COBRA coverage is going to end on the date you get Medicare. And then when that happens, you will need to enroll in Part B immediately, because you're not entitled to what's called a special enrollment period. So basically, the most important thing is you have to think about which insurance you have first. If Medicare is active, you can have COBRA and you'll be good. But if you have COBRA active first and you're eligible for Medicare, I would say reach out to a benefits counselor as soon as possible so we can walk you through that process. Because if you don't enroll in Medicare within a certain period of time, you will be paying a penalty for the rest of your life. And the COBRA one is a common issue that we see in the Austin area. So I would say it depends on which insurance you have first.
Thank you. Someone asked if you have mentioned the available Medicare Health Plan Analyzer, and they said that's where you can enter your meds and it computes costs to give you details on plans and that you can sort. I'm not sure if you guys had mentioned that, or if where somebody can find that.
So that is on the Medicare.gov website. That is the Plan Finder tool. So let me do this. So Natalie, let me see. I'm gonna share the screen again, and I'm gonna show you. So if you go to the Medicare.gov website right now, it's still before open enrollment, but as of October 1st, information on Part C and D plans that are available in your area, all of that was posted online. So right now you can preview what's going to be available based on your zip code. So when you go to Medicare.gov, you can click on preview. And what it's going to do is it's going to come up to this screen. So we'll say continue without logging in. You don't have to create an account. And then what you're going to do is then you're going to select what you want to look at. And so we'll say we want to look at Advantage plans. We're going to put in a zip code. And it's going to ask you if you get help with any of these programs. And we're going to say no. And then it's going to ask you, do you want to see drug costs? And it's going to ask you if you want to look at retail pharmacy information, mail order pharmacy information, or both. So we're just going to put a medication that we commonly see. And we're just going to do this. Okay. And then we're going to look at pharmacies that are available. And you can look up to 3 pharmacies, but I'm going to include mail order in this situation. Ooh, now they've expanded it to 5. Wow, this is new. Okay. Click done. And then it's going to show you, it's going to organize the plans by lowest drug and premium cost. And it's showing that in Travis County, we have 26 Medicare Advantage plans available for 2021. And so this is how you would be able to look at the plans, considering, you know, I added that 1 prescription in there. So it'll show you, once you open plan details, it's going to show you, it's going to break down the cost. See, even though we're looking at an Advantage plan, you still are responsible for that standard Part B premium, which this year was $144.60. Now, this plan, as an example, has 0 monthly premium and also does not have a premium for the drug benefits. It also doesn't have deductibles. And then as you scroll down, it's going to let you know that this is an Advantage plan, so it's operating through a system of networks. And it'll let you know what you'll pay if you stay in network and what you would be responsible for if you were out of network. So this is called the plan comparison tool. Now, if you are also, you know, more than welcome to play with it, you know, look at a couple of plans. And if you just want a second opinion, you can still contact us as well. You know, we can discuss what what research you've done so far, and then we can kind of, you know, look at, you know, pros and cons of each option you looked at, and then we can kind of help create some questions or just some points to consider as you make your final decision. I do want to say we can't make a decision for you, but we can give you some helpful tips and hints to help you make the best decision for you. So again, this is on the Medicare.gov website.
Wonderful. Thank you so much for walking us through that. I will also include that link in a follow-up email to everyone. There's just really great resources to look at and to share with everyone. So I have another question. It says, what is the Medicare Part A skilled nursing facilities coverage?
Alice?
You want to take that, Delia?
Okay, what it covers, okay, can you ask the question again?
It is, what is the Medicare Part A skilled nursing facilities coverage? Okay,
In a skilled nursing facility coverage, what they usually pay, most of the times you go in there for physical therapy. And one thing, so it pays for you to stay there, and it usually gives you a limited of days. And they usually start no more than 20 days. And you have to get evaluated by the physical therapist. They have a team there in the nursing home, and they'll say, you know what, we've given physical therapy to Delia. She's not cooperating. She refuses to learn, and she doesn't want to do anything. So she's not accepting the physical therapy. So they'll kind of talk to the family and say, you know what, it's not working out. If there's no improvement, Medicare will stop payment because there's no improvement, because the goal is to improve the physical therapy. So they'll go ahead and release them, or they can continue. Now, they are reserved days, but again, all that has to be pre-approved by Medicare.
And that is usually, that type of help is usually received after a hospital stay?
Yes, yes, definitely. Yeah, they have to be there at least 3 days or 2 days.
At the hospital.
And there has to be some type of physical therapy or wound care or some type of treatment that needs to be done that can be done in a rehab.
Wonderful, thank you. So I have another question. This question is it true that if you receive Medicaid, you have to pay all of that back once you pass?
Okay, that is the MIPPA.
Okay.
That's the MIPPA, which is a state recovery program. And Texas was one of the last states that went ahead and adapted this. This has been going on for years and years in different states. And I think this started like 10, 15 years ago. But they're not targeting people that are receiving Q&B or provider services. They're looking for people that, because Medicaid has a big umbrella. So they're looking for the people that have Medicaid nursing home. And that is what they're targeting. But under the Medicaid estate recovery rule, there is so many exceptions to the rule. If your house is worth less than $10,000, if somebody's going to be homeless, if you have a spouse, I mean, there's a lot of them that will be, if you still owe the house, if you have some type of a second lien on it, then all that will be first before the state wants to take it. And always remember, the state's not into the real estate business. They're just to try and recover some of their money. So they're looking for the bigger, nicer homes. Did that answer the person's question? And if they still have questions, they're more than feel free to call us at the office and we'll explain it into more detail.
Thanks. There's another question. What's the donut hole or the donut people talk about when they talk about Medicare?
Alice?
So technically the donut hole went away last year. It's now been replaced with what's called the coverage gap. So basically it's the period of time where and it's related to drugs, to prescription benefits, because there comes a time where you have been paying your copay for a medication, the insurance company has been paying their portion of the what's due for that medication. You'll reach a level to where you then become responsible for what's called the true out-of-pocket costs of the medication, and that's where you may see your prescription costs kind of skyrocket out of nowhere. So that's where you have hit what's called the coverage gap, and so you will remain in that coverage gap until you hit a certain another benchmark. And there are certain values that Medicare uses for each year, and so I don't know them at the top of my head, but there is a graphic that kind of tells you what that amount is. Once you've reached a certain value, then you hit what's called catastrophic coverage, and that's when your prescription costs then drop significantly to where what you're paying for out of pocket is the lowest. You'll be paying, I want to say like no more than like $9 a month for a name brand prescription, because you have hit the catastrophic level of coverage and benefits for prescription benefits. So, so the donut hole, prior to that, when we had the donut hole, it really was like you fell into a hole when it came to paying for your prescription benefits. So it is kind of misleading. You know, people say, well, you know, the coverage gap is similar to the donut hole, but it's not as it was not as a big of a drop as it used to be. But basically what it means is that you'll reach a certain level where you will be paying more out of pocket for your prescription costs. But people hit that level when they're taking a lot of name brand specialty medications. So that's one thing to keep in mind, and something that we haven't really brought up yet, just because we're still trying to learn information about this. For those of you who are on insulin, there is a new Part D model that is being rolled out during open enrollment. And it's specifically for people who are on insulin. Certain plans are offering a program where name brand insulins will be no more than $35 a month for a 30-day supply. As of right now, we don't even know, we don't know the exact names of those plans right now. Like I said, information on the new plans were just unveiled on October 1st. So if you know someone who is on Medicare and takes name brand insulins, please let us know. Send them over to our way, you know, to our agency, so we can talk more about the Medicare Part D the model for those people that are on insulin. Like I said, it's a new option for this upcoming year for Medicare. But so yeah, so that's pretty much what the donut hole or coverage gap is. Delia, do you have anything more to add?
Yeah, I think this year the donut hole is going to fall to 6,500.
Mm-hmm.
So you've had to have spent or used up that much before you fall into the donut hole, and then that will start up.
Thank you. I have one more question. Let's see. It says, what's the difference between Extra Help and Medicare Savings Program?
Extra Help and Medicare Savings. Extra Help is to help pay, and that's through the socialsecurity.gov website, and that's to help pay for your medications. And the Medical Savings Program, that's through the state of, well, here it's the state of Texas, and that helps pay for your premium, which is $144 plus the A and the B. I mean, it'll pay your co-pays for the A and B, sorry.
Wonderful. So I have one more question. I know we're getting close to 11:30, and I want to be respectful of everyone's time. Actually, it's two and one. So it says, have there been Medicare Advantage plans found to be fraudulent in their claims to older adults? Has your office found that these plans overstate their benefits? Has that ever happened?
So, yes, I will say this. So, something that is important to know. So last year, it was Advantage plans were allowed to advertise additional supplemental benefits with their plans. A lot of them were like, you know, home delivered meals, some home modifications. The one thing that they kind of left out in their advertising was those extras are only for people who would qualify based on their health conditions. So it wasn't for everybody that was on, you know, that specific Advantage plan. So that wasn't really advertised clearly. So, you know, it does happen. The thing is that right now, the risk of Medicare fraud during open enrollment, it skyrockets because everyone decides to now, they want to get involved in the Medicare game. Just remember that the most important thing to remember is if something sounds too good to be true when it comes to an Advantage plan, more than likely you're right. If you encounter a salesperson offering something that seems too good to be true, or you just want a second opinion, you can contact us and report that information to us. We are affiliated with the Senior Medicare Patrol, and they're the ones that actually do the investigations for Medicare open enrollment fraud. And we will report people who are engaged in, you know, questionable practices. Also keep in mind, you cannot receive any cold calls or, you know,
Somebody knocking at your door.
Yeah, front door solicitations without you making contact first. A Medicare insurance plan is not supposed to contact you, you know, without you making some sort of initial contact. And also, you know, keep in mind that, you know, I mentioned this earlier, you do not have to enroll in a Part D plan if you don't want to. I mean, and so if someone tells you that you have to enroll in a Part D, that's also considered fraud as well. And that is reportable. There are very strict rules as far as what Medicare agents, sales agents can and can't do. Most importantly, they can't say that they're a Medicare representative. Delia and I are not Medicare representatives. They don't exist. There are no Medicare sales representatives. So the minute somebody represents themselves that way, that's fraud as well.
Yeah, and right now you're getting a lot of calls that your provider referred them to you because you need a back brace or a leg brace or some type of, now they're doing the emergency response unit as well. And, you know, if you have nothing else to do, play with them and tell them, I'm not on Medicare or you know, but just hang up the phone, probably the best thing to do, because they're just out there to try and get your Medicare information as well. And that's one thing that you do not want to give out. I mean, that is like, you know, something very important to you. And if they're calling you to try and get this information, they don't have it. So they're just soliciting.
Sorry, I'm so sorry.
No, that's fine.
One more thing that did come up, and then we'll wrap up. Someone posted in the comment section that in my observation, Facebook has a lot of clickbait when it comes to Medicare. Does Senior Medicare Patrol have a list of known violators? Do you know if they monitor that type of like social media? Okay.
They do, and actually, Senior Medicare Patrol, I want to say they have an active Facebook page. They also post videos on YouTube on scams of the week, and you'd be surprised at how many scams there are that target older adults. So they have an active Facebook page. Like I said, they're the ones that, you know, they're interested in all of that. They also are have been what was it? The last 2 years, the biggest thing they were targeting were the you know, like the DNA tests, like the swabs. Apparently, those people were targeting senior like health fairs and stuff like that. And they were telling people to, you know, get swabbed to see, like, they said that there was one where people were like, do you want to know, like, basically, you want to know why you're fat, you know, like, and people were falling for it. And so, and they were collecting Medicare information that way. So they targeted those, you know, initiatives, and they actually worked with the Attorney General's office on those.
That's awful. Thank you for all of that information. That's really, that was incredible. And please know that if you have any other questions, please feel free to reach out to me, Natalie with Age of Central Texas. I mean, I will happily guide you to Alice and Delia, and or you can just reach out to the Area Agency on Aging Benefits Counseling program. Again, thank you all so much for joining us today. I hope that every one of you are able to get out and enjoy this beautiful day. It is gorgeous. And I look forward to receiving surveys back. And remember, I will send all of this information out in an email, hopefully on, well, Monday. I will absolutely have it to you on Monday. So you'll have a link of this recording and some resource information that came up during this presentation, and then contact information. So you have a go-to email to refer back to. Thank you all and have a wonderful day.
And also remember that the mission is to spread the word. Let
Yes.
your neighbors, let your friends know that we're here to help.
Yes, thank you. Yes, that's the most important piece. Thank you. Have a wonderful weekend.
Thank you.
Bye.